Olá, pessoal. Olá, todo mundo. Hello, everybody. Today we have a lecture, we have a talk here with Dr. Hassan, so it will be in English. Pessoal, vai ser em inglês. Vocês têm a possibilidade de colocar as legendas aqui embaixo em português, caso vocês tenham a necessidade. So, Dr. Hassan, I know that it's my pleasure to have you here. We are friends for a long time, and I know how dedicated and how a good doctor and specialist you are as a movement disorders. So it's very nice to have you here and discuss some very important topics. So please, for the people that doesn't know you, can you just introduce yourself?
Certainly. Dr. Mariana Mostovich, thank you very much for having me on your show. Yeah, I'm a movement disorder specialist. I trained in Ireland, Australia, and I worked in the United States for many years treating patients with Parkinson's disease.
Okay, great. So yes, I know that more than 10 years working with patients with Parkinson's. So we have a few topics that are highlights here in this channel. And one of those that I think that actually is, we need to talk more about this, is about impulse control disorders. So we know the impulse control disorders can happen in certain patients with Parkinson's, especially some patients that use certain type of medications as dopamine agonists. So, but I see that many doctors do not approach this issue directly with the patients. Normally sometimes they wait to have some complaints or something like that. But I think it's very important for us doctors when we use this type of medications, which can be good in some patients, but the side effects should be always talk with the patients. So please, can you talk a little bit about impulse control disorders, and what is your opinion about dopamine agonists? If they still using, what do you think? At what time will be the best time, or what is the best patient that we can use this type of medication?
Okay, so dopamine agonists are medication that are used to treat some symptoms of Parkinson's disease. It can also be used to treat a condition called restless leg syndrome. And there's a number of different agonists available: pramipexole, ropinirole, which are tablets, and then the rotigotine patch. And then the older ones that are no longer used because of heart side effects. So they've actually been taken off the market.
Yeah.
So these medications have a potential of causing a side effect called impulse control disorder. And impulse control disorder is where patients develop this pathological or compulsive behavior. And the most typical ones are compulsive gambling, compulsive hypersexuality, compulsive shopping or hobbying, or excessive spending. And these are usually out of character behaviors for they haven't done these behaviors before, and they can be very disruptive. I mean, they can cause significant problems in the family. And with their spouse, with their children, and so on. So they're a real problem. And they can happen in about we did a study looking back at this in patients who were taking dopamine agonists for Parkinson's disease. And about 1 in 4 patients developed this side effect when they were taking like the medium dose of a dopamine agonist. Patients that were taking a higher dose, it was 1 in 3.
So it's dose dependent.
It's dose dependent. There's also some other risk factors. So some other risk factors are males are more likely to get this, younger patients. And also if a patient is also taking levodopa. So levodopa plus a dopamine agonist increases the chance of this happening.
And patients also that have some history of addiction in the past also.
Sometimes, yeah, that's a risk factor as well. So the main thing is we don't know of 1 in 4, 1 in 3, who are these patients who are going to get. So it's important to tell all patients who are starting an agonist, this can potentially happen as a side effect. And so you warn them up front. And every time you see a patient back for a visit, it's important to ask them again. So patients who are on the medication, it's important to kind of try and be aware this can happen, and also to let the family members know, because sometimes the first ones who can spot this change in behavior, the patient notice something different.
Yeah, I see this very often in the clinic, that the patient do not complain. So the man that have hypersexuality, for him it's okay or doesn't matter, but then it's very disrupting for the spouse or for the other significant other. So, or the woman that are shopping a lot say, oh, I always do this. So they do not realize that it could be a problem, and who normally realize are the family members. Family members should be aware and should be asked directly during the interview, during the consultation. That's why I think that normally I really like that family members come together and at the clinic, so we can also ask the families about how they are doing, because it's very important to take care of the family as well. But to ask about these questions, because normally patients do not complain about this or any other symptom they do not realize. They're doing, for example, for sleeping, nothing with ICD, but like with sleeping, they're like, oh, I'm sleep good. But normally they can have like REM sleep behavior. They are not realizing that. So I think that family members are very important. And when we talk about ICDs, impulse control is also important, right?
Yeah, I think that's totally correct. And then there's actually one other one I forgot to mention, which is binge eating. So that's one that can happen as well.
Yeah, yes. So so if the patients have this problem, what the patient should do, or what normally we can do it to improve or to ameliorate? If you stop the medication, normally the symptoms are gone, or what they should do?
So that's right. So it kind of depends on how much of a problem it is. I mean, if it's a problem, people are spending a lot of money, or it's causing a strain on the marriage or something like that, it's important that we think about taking the drug dose down, and sometimes even stopping the drug completely. The drug stopped cold turkey. It has to be stopped gradually. It's important, and the behavior usually goes away. That's typically what's seen. And in the meantime, then some other medication in replacement is used.
Yes, because sometimes when we take it out, then they feel a little bit more rigid or tremor or something else. Yes, then we need to change. So this mainly happen with dopamine agonists, but can happen with the other medications like levodopa, amantadine, or any other?
There's some reports that it potentially can happen with these, but the evidence is not that strong. And these are really kind of limited reports, I would say. The strongest evidence is really for dopamine agonists. And as to not clear, it may be the way that they bind to the one of the dopamine receptor subtypes in the brain. And that's the theory, is that it's the way that it binds causes this particular side effect in a behavioral part of the brain.
Okay. So for those patients that now are afraid to take the medication, that now say, oh, so I don't want to do it, I don't take it anymore, or I'm afraid, what should you say to these patients?
I think it's a very useful medication in the right circumstance. So if people are taking it, they're not having any bothersome side effects, and it's helping symptoms continue. There's no harm there. But just to be aware that this side effect can potentially happen, and so that they're aware and their family are aware. So if they notice this change in behavior, they bring it to the attention of the doctor, and then they can be reduced or discontinued if they're in agreement together about that plan.
Nice. So if the doctor prescribed, the patient do not need to be afraid, just should be on track on it. As any other medication, have side effects as well. So we always need to take care and look closely at these patients. So, okay, I think they have a good summarize about ICDs, impulse control disorders. It's a topic, very hot topic in here. So thank you so much, Anahar. Thank you for your time in here.
My pleasure. Thank you, Marianne.
Okay. Bye-bye.